Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. Today's guest, Dr. Michael Bagnell, raised the roof on brain health and how to fix and keep your brain healthy. Keep watching. Hey everybody, Dr. Rob Silverman here, Proven Health Alternatives. I've got Dr. Mike Bagnell here, good friend of mine, get to see him all the time, superstar in the area of chiropractic neurology, and functional medicine. Doc, pleasure to have you on.
Thank you so much. Great to be with you always. Now it's a little bit distance, but I always appreciate your time.
We're still going to make that connection. So let me give you a little background on Dr. Bagnell. He's practiced in South Florida for 30 years. He has worked with thousands of children, adults, solving their health mysteries. That's why he wrote his book, good book, got it, Health Detectives, Solving the Mystery of Health Through Neuroscience, Nutrigenomics, and Mechanobiology. You see a ton of patients for brain-based healthcare and performance in Pinecrest, Florida, which is a suburb of Miami, right near the University of Miami.
That's it.
So right off the bat, if they want that book, how can they get it?
Well, right now we're waiting for the next edition to come out because we've sold out, which is a good problem to have, but it'll be available on Amazon in a few months again.
Excellent, excellent. So we'll update on that. So real quick, what is brain-based healthcare?
So this is really like the hub of everything, right? We just talked about this. So the book title, Health Detectives, Solving the Mystery of Health Through Neuroscience, Mechanobiology, and Nutrigenomics. It's a mouthful, but when we talk about brain-based healthcare, we're talking about looking at whatever the health presentation is with a brain-based view. Now, what does that mean? That sounds really fancy. Really, I've heard this already said by another doctor, so I'm just going to bring it in. Everything that we do in our environment, walking, talking, moving, driving, eating, relating with our spouse or significant other, our children, learning, requires our brain to be involved and engaged. And everyone would say, of course it does. So when we think about then the problems, and let's just name couple of them, headaches, migraine headaches, which we're going to talk about a little bit, ADHD in children and autism spectrum disorders in children or adults. And then chronic musculoskeletal complaints that many of our athletes or just the average person like me and like you, we get. So from pain to severe things neurologically, which we say, oh, that's a brain condition, a migraine headache, or the children, we're looking at the view of their entire picture of health from a functional medicine standpoint, which is what is their metabolism doing? How is that interacting with their potential problem? How is their brain functioning through very special techniques that we use to analyze the brain, because now we can do that non-invasively. And we put it all together to determine, is the problem somewhat in the brain and somewhat in the body, or is it primarily in the body and the metabolism? And so we're trying to understand, or I'll use this language from neurology, triangulate. Where's the challenge? Where's the problem? Where's the functional imbalance? But up until this point, most healthcare has been from here down. I think you would agree, here down, and not here up. And so now we're just adding this piece into the equation because we can analyze the brain in a non-invasive way for men, women, and children and find out, is it playing a role in their problem that they're presenting with, their limitation in their life?
Well, right now, this area, and you know it, as an expert in it, is maybe the hottest topic of conversation right now. You know,
exactly.
Brain is in everybody's vernacular. So with that being said, what types of people, conditions, patients do you work with?
Well, we have quite a volume of pediatrics and adults. So we have two different distinctions or groups of folks. In the pediatric model, the children that we see, the young people that we see, I have one that's actually coming tomorrow we've been working with for a few weeks, and he's 4.5, he's almost 5. And his major presentation is the attention and the behavior. The mother and father were concerned with. He just gets so aggressive and angry at 4.5. Can you imagine? So that's one. We see a lot of children with ADHD in the, I would say, 9, 10 to early teens. We have mood disorders. So we have anxiety, depression combination in our late teens and college kids that we see, many of them. Post-concussion effects, like you see many people with concussions and post-concussion sufferers. So we see them and they have a variety of complaints. And then we get into my age and your age and my age in my mid-50s. I'm not sure where you are, Doc, but
I'm right there, baby. Best age to be, right?
Stress, pain, stress, my sleep is not so good. Like we see a lot of sleep disorder. I know you and I spend time on a panel discussing all the aspects and uniqueness of the importance of sleep, how to restore it nutritionally, metabolically, and through brain training. And then we all the way up to the top, our parents' age, if your parents are still around, and we have cognitive decline, early Alzheimer's, it looks like, Parkinson's, memory issues. So the whole spectrum, we get all types of things. And migraines, as I mentioned, is a real big issue. We're able to get some dramatically good results with people suffering.
Now, with all these conditions, now you've been practicing 30 years.
30 years.
Now, yeah, it's a good amount of time. You would be, as my mom said, you've passed the litmus test in experience. She's going to go to you, my Jewish mom at home. So to speak to that, we've noticed a tremendous change in brain health over the last decade or two. Is there anything you can attribute that to?
Yeah, I mean, you and I would both agree that the very common things that most people realize that have affected their brain are blood sugar elevations, poor diet. But blood sugar elevation now, we're even calling it the type 3 diabetes, Alzheimer's, right? Unofficially. So we know that blood sugar being elevated for too long is a bad deal for the brain. And we also know that blood pressure being too high is a bad thing for the brain. So whether the blood sugar's high or the blood pressure's high, or even, as yesterday, the blood pressure is low. If the blood pressure is too low, we may not be getting enough blood volume up there. But I would say metabolically, blood sugar, immune problems. So we're carrying a lot of immune baggage, viral loads and things like this. And then the other one is inflammation, which you and I, you're the expert on the inflammation. Wow. But if your brain is inflamed, if you have too much of an immune load in the system, a child or an adult, and if your blood sugar is not regulated, your neurotransmitters are not going to be right. Your brain's not going to work optimally.
So great stuff, great takeaways, really epigrammatic. So the question is, what would an evaluation look like of the brain, and what would you do in the evaluation?
Great question. I like that because people are always asking us, well, how can you analyze the brain? So I talk about several different layers. Okay, so the first layer is we're going to do, it might be the deepest layer on our patients. We might do a cheek swab on the inside of the cheek and do a genetic profile on many of the aspects of what's going on with their brain, certain genes that affect neurotransmitter production. So we want to know that test right away with many of our clients, especially with depression, anxiety, migraines, sleep disorder. So we might get that genetic test in, I would say, 95% of our patients. It's a one-time test. Tells us a volume of information. Number two, we put on a cap and we do, as you do, a brain map, a QEEG, right? So heart is EKG, brain is EEG. And then we measure that. What are the electrical activity in regions and hubs and networks of the brain? So those are two. Then they sit on my table, which I'm sitting at right now in my exam room, and we do a full neurologic examination. And that will take anywhere from 20 to 45 minutes with me face-to-face, going through every different neurologic test, motor, sensory, to determine what's going on in their brain and their body from a neurologic perspective. And then we're not done. Then we go on to eye tracking technology, watching that with some very high-level pieces that we've appropriated in the office to analyze the eye movements, because eye movements tell us about the brain, and the brain shows changes in eye movements when it's not working well. So balance testing is another piece of the exam. So we do a lot of different diagnostics, really remarkable. All these things are non-invasive. The total time would be almost 2 hours with me. And we just know top to bottom what's going on with your brain and body at the end of that exam.
I'm happy you mentioned the time, because the question had come up, how much time do I have to spend? Because the typical chiropractor, you're very atypical, is 5 to 15 minutes, and I'm happy you addressed that. But you brought up some terms, brain mapping and neurofeedback. Can you tell me what they are?
Right, so brain mapping is a way to understand electrically what's going on in a person's brain, to keep it simple. And we have different brain waves, which we won't get into all of them, but there are normative ranges for those brain waves. So if you're asleep, certain brain waves are higher and certain brain waves are not, and vice versa. So we map the brain and see if it's dysregulated. Is the brain dysregulated? It's not in its normal pattern, because we check brain waves against a normative database. And then we can use neurofeedback to train the brain in those areas to improve its functionality, to re-regulate itself. So we put different instrument on a person's head, they're watching a screen, their brain waves are set at a certain parameter. This is where we want to train them. Actually, I think the good analogy is for feedback. I use the basketball all the time. So if someone goes out to the court and I say, stand at the free throw line and shoot, and they miss all of them, I move them up a little bit until they start hitting 4, 5, 6, 7. Now I move them back a little bit. So neurofeedback works by adjusting something you're watching or hearing as your brain is more efficiently in the right zone. If it goes out, it changes. So you're getting feedback as to, is my brain performing in the right zone? So we want to train it to work in the right zone, whether that's stress reduction, sleep improvement, attention. We can set the brain waves on the computer. This is where we want to train, and we reward the patient with something visually or auditory when they're in the right zone.
What conditions do you use the mapping and the neurofeedback for, and do they help?
Yes, we consider that part of our initial evaluation. So everyone gets a brain map because we want to understand every aspect of their brain, as I mentioned before. And we use the neurofeedback, I would say, with about 90% of our clients, because we're working on many levels. Not only working metabolically or through functional medicine to balance some of the chemistry and the environment internally, but we want to train every aspect, whether it's through neurofeedback, which is a prime source of training the brain.
Now, can the brain improve or heal with training? So many people ask that. There's so much good literature on it. Can you answer that and explain how?
Yeah, sure. The brain can learn. Of course, we all know, we've all learned how to speak a certain language, maybe multiple languages, some of us, as you just demonstrated. So we can learn. The brain can learn. It learns how to do new things, and it can learn through the lifetime. You can learn new things outwardly, how to do different aspects of activities or exercises or Tai Chi. You can learn. So this tells us that the brain has the capacity to be moldable, to be malleable, to learn. So internally, if we start causing it to train itself in a certain direction or brainwave, we can actually create plasticity. That's the key word, neuroplasticity. You know it better than I. Neuroplasticity is the goal from taking someone and building a new pathway in the brain. So if they have this anxiety pathway that's really has a groove in their brain, and we can start to change the pathway. So when they have a certain stressor, they, instead of going in that direction, we create plasticity in a different direction. Now the brain becomes stronger, learns a new way of behaving to a stimulus. And that plasticity is what we're always after. We're after generating plasticity in the brain, getting it to learn a new way, and long-term potentiation, that it would last. And that's always the holy grail, I guess you could say.
That's great, because so many people use neuroplasticity as a buzzword, and as well, you've explained to everybody, you can have a concussion and get adverse or aberrant neuroplasticity. You did that with the fork in the road. It was so important, because it kind of it's one of my pet peeves. Well, neuroplasticity, I'm like, well, run into the wall, knock yourself out, and see how you walk after. But there's another one that I'm sure a lot of the docs and some of the patients have asked me, brain neurogenesis.
Neurogenesis. Wow, this is a real interesting one. We know some older research, and older meaning only within the last 10 years, talks about a lot of the neurogenesis only being in the hippocampus, down in these temporal lobes. We won't get too scientific, but through a lot of aerobic capacity. But now we know that, no, it's actually expanding. We're seeing neurogenesis, or neurons in the brain, genesis, the rebuilding. We're seeing neurogenesis capabilities in other regions of the brain as well, depending on the type of stimulus there. So we're very hopeful for people. There's a variety of other things, therapies that help with neurogenesis. Nutrition is one of the key things, aerobic activity. But we also know, just like stimulation, so it's not that I have big muscles, but if you stimulate the bicep, it grows. If you stimulate neurons in a particular region, the right frontal cortex, that area is going to become responsive. It won't grow so much, but it will stimulate proper growth or health of the neurons in that area. So we want to stimulate or activate neurons in target regions of the brain, and that's really the key to how we start applying these therapies.
That I can tell your excitement level comes up, because David Perlmutter, a very famous functional neurologist, speaks about brain neurogenesis and the literature finally being accepted in 2013 after a long list of articles had come out. And, I guess that growing back of nerves is exciting for patients to understand. If they go to someone like you who specializes in brain, they can get a lot back of what they lost. But you said something. You said nutrition. So I'm not going to let that slide. Can nutrition affect my brain, and how?
Oh, absolutely not. It has nothing to do with our brain. Not really. Of course it does. It's probably the most crucial thing, because you're putting things into your body every day that are allowing you to repair or not repair, allowing you to have better functionality or poorer functionality. Like we said, the four, which one are you going to choose? I like what Dr. Daniel Amen says. He says, every decision you make is based on your brain function. In fact, everything you put in your mouth is based on how your brain's working. I want that. I don't want that. And you're making decisions. So if your brain's poorly working, you might be making poor choices for nutrition. But nutrition is crucial. I'm talking to the probably one of the experts in all of North America, being you, in terms of nutrition in the brain. But it's vital. It's vital. So like the little child that we're working with, 4.5 years old, we have his mom. We've got some fish oils, a very good source of omegas for him. He's also using some child dose magnesium. So we're working with his brain health by working through some of the nutrition. Another child with, is about 9.5. We just saw him. These are fresh. These are yesterday. He's about 9.5, I believe, almost 10. Very bad ADHD. We had to get the cereal out of the diet. So we added some things, but we also deleted some things or recommended to the mom, because he was a cereal junkie. He couldn't stop eating cereal. Breakfast, and then he wanted it for dinner, and they were just giving him cereal. And so this is just not helping him to stay in balance in his brain function.
So nutrition helps the brain, but we've talked about this a lot. It's the hottest topic, or a hot topic, the gut-to-brain axis. So give me, tell everybody what your feeling is, how that works, etc.
So gut-brain axis is what everyone states when we talk. Hey, I know about the gut-brain axis. And I say, do you know about the brain-gut axis? In a somewhat facetious way. And they say, what are you talking about? Gut-brain, it's bidirectional. We know that, right? It's top to bottom, bottom to top. So here's what a lot of people are not as aware of, I would say. I love that people are aware that their gut plays a significant role in their brain health. So I love that they understand that. And so they want to take care of that. But very few, I have found, realize that your brain and certain regions in your brain control motility in the gut, secretions in the gut. So when the brain's not working, we may not be able to get that gut function upregulated, and then we may be throwing nutrition in that's not getting properly absorbed, or nutrition that's causing things to happen in the gut. For instance, let's say someone has poor motility and they're taking a lot of psyllium husk, psyllium seed, and they're getting motility, or they're drinking a couple of Cuban coffees in the morning, and they say, no, I have normal bowel movements. I say, well, how much coffee do you drink? 10 Cuban cups, 10 small Cuban shots. And I had this actually. They said, no, I'm completely normal. I said, what if you don't drink those? No, I don't go to the bathroom. I said, okay. So maybe that person's brain wasn't working so well, and they were treating more the gut with something which was not the ideal thing. But the point being that we have to consider both areas when we're looking at someone's health, because especially if there's a gut issue, we don't know. Is it somewhat brain driven? And then if a person has a brain issue, clearly a mood disorder, then we would, hey, let's look at their eating and their gut. So we're looking at both factors because it's a bi-directional. I like these, like my images.
Yeah, I think it's great. I love the idea of bi-directional. So essentially, if you have a problem with your brain, you'll have a problem with your gut. If you have a problem with your gut, you'll have a problem with your brain. So as much as you're saying a brain center, you're doing gut work along with the brain center.
Absolutely, we have to. We have to pay attention to that as well.
Outstanding. What are your top 3 supplements?
Top 3 supplements. Well, you and I talked about this just at a recent conference we were speaking at. I really am a huge proponent of omega-3s, a really good quality omega-3s, sometimes an omega-3, 6, 9 blend. People use different things, but I like an omega-3 source that's healthy, that's coming from a good source. And we have to be careful these days because everyone's on the same bandwagon when it comes to, yes, we need them. So we never go cheap, and we always try to find a good quality omega. The second thing that I really am a fan of is glutathione, whether it's taking NAC, the precursor, or taking some other type of glutathione. Some people are doing IV glutathione. I don't do that here. So I think glutathione is very important, especially as we age, or if someone is in a toxin-laden environment, as you would say, because that glutathione, which is already made by our body, helps us to detoxify a lot of things from the inside out. Number 2, that would be. And number 3, I'm often looking for a good probiotic or gut stabilizing supplement. So I switch probiotics periodically for myself. I switch them periodically. I try to stay with a SIBO-free or SIBO-friendly probiotic for myself. So most people understand that because I have dealt with SIBO myself. I've dealt with numerous concussions playing sports all the way through college and from Little League to college. So I am one of my own patients, to be honest. And those are some of my go-tos all the time.
Outstanding ones. That glutathione, I love them all. Give me 3 things for daily brain health that everybody can do tomorrow.
Exercise, exercise, and exercise.
Are you sure about the exercise?
I'm not going to reconsider. I think that's the go-to. Yeah, it's the thing that shows the most literature, I would say, at least as far as I have looked. There's so much literature that tells us exercise is good for the brain, from the aerobic exercise we mentioned for the hippocampus and for the temporal lobes and for memory, getting blood flow to the brain. Strength exercise is very important for frontal lobe activity. I like yoga very much. I do that with my wife. We do go do Bikram yoga, so hot yoga. I like that. Sweat like that is very good for calming down the cingulate, the emotional cortex, and developing a way of stabilizing myself and working through something that's difficult. So different things, and then coordinated activities. So I do things, I do backward running at the field near my house. So I'll do short intervals of backward running, just because that's a completely different pattern of movement, and it's very good for the brain. So exercise would be one. Number 2, I would say, is that we need to learn how to breathe. Breathing is crucial. You say, really, for the brain? Yes, because the brain needs oxygen, it needs blood sugar, glucose, and it needs activation. So you can't just take in the oxygen and then the glucose and not exercise the brain. So exercising the brain through physical exercise, movement causes the brain to work, and then being able to breathe is going to bring the fuel in there. That's really important. So what do we say? Exercise, breathing, and there's actually a really good app or a number of apps. And this one, a friend of mine, a PhD, recommended the other day, and I just got it and I love it. It's called Breathe to Relax. Breathe to the number 2, relax. Yeah, it's a free app. I think it's brilliant. It shows you resonant frequency breathing, so people can learn how to calm themselves down by breathing. That helps to decrease tics in some people, anxiety in some people, depression in some people. Wow. Most of us never take time. We're actually always on this thing, right? Scrolling and doing work, and we're never taking a minute to slow it down. And so breathing and exercise, and what else could people be doing? You know, learning things as you get older, I think, is very important. I remember there used to be a close family friend. I'm taking a lot of time with this, I'm sorry, but he was in his 80s and he learned how to snow ski when he was in his 60s. That's brilliant for the brain. So if you go from doing something where you're an expert at to doing something where you're a complete novice and then getting through the point of learning how to do something, that's really quite excellent for brain health. Taking on a new thing that you're not even understanding how to do it, go and take piano lessons, learn how to play the piano for 3 years when you're 40 and you've never played before. Do it. That could be a great thing for you.
Fantastic. Does this approach work for ADHD sufferers?
Which approach? The exercise and things like that?
You know what? Let me rephrase that. Give me an approach for those who have ADHD that you would recommend.
Well, I think we always want to look at the diet. That's really important. I mean, if anyone goes to a pediatrician these days, an allopathic doctor who's really kind of current in treating ADHD, they're going to probably give them fish oils. There's a prescription fish oil that they use. And oftentimes they'll give them a prescription methylfolate, which is a B vitamin, because they know a lot of kids are dealing with certain genetic things that are affecting their B vitamin processing, and they may contribute to their ADHD. So we want to look at their diet. We want to get that diet healthier. It's hard with kids. I'm a parent, I'm a grandparent, so I understand. But it is a battle that we really need to, in some way, fight it a little bit more veggies and things like that. So I would definitely go towards health through the nutrition and that for ADHD. And then getting evaluations through the types of things we do, functional neurologists or chiropractic neurologists, helps people to understand their options, because we treat a lot of these kids who have been through the system. They have the medication. and they're just not really that much further along. And we know there's a very high percentage of people with ADHD and ADD that end up later substance abuse, issues with law enforcement, and so on and so forth. It continues to catastrophize. My son will tell me how that word goes, but it continues to get worse with people. Not everyone, but very common issues. That ADHD imbalance in the brain can lead them down a bad path as they get older.
What great answer, because ADHD is such a commonly used diagnosis and probably a misdiagnosis. We should probably do a whole session on that alone.
Yeah,
what percentage of health issues involve the brain?
Wow, I think you're speaking to someone who's biased. I think that we're still understanding just what role and what percentage the brain plays in many of these disorders. And I think the jury is still out somewhat on that, because as neuroscience, like you said, it's really contemporary. Everyone's looking at the brain. As we're getting more research in day by day, we're realizing, wow, the brain is very involved in hormone regulation. Wow, the brain is very involved in what's called the neurobiology of food addictions. So anorexia, bulimia. The brain is very involved in urinating at night, not being able to, or having to go many times as we get older, or bedwetting. So the brain can be involved in a lot of these conditions, and we're starting to understand the connections as more research comes out to many different health conditions.
Migraines, you mentioned it earlier. I just want you to close that loop now. Can migraines be improved through the brain training? It's common.
In a word, I would say yes. They have a great potential to change their frequency, severity, and duration through analysis of where this is stemming from, but we know it's mostly in the brain stem, and then certain types of training. So we do the whole analysis. We understand primarily 3 areas. Are there hormones involved? Is there immune involved? And where in the neurological system is it primarily involved in? And a friend of mine out in Dr. Harcourt out in Beverly Hills, who's a migraine specialist, he gives the analogy of a bucket. And he says, this bucket is your migraine bucket. When it overflows, you have a migraine. So if you're under a lot of stress, that bucket fills up. If the weather changes a lot for some people, the bucket's filling up. If your hormones are dysregulated, the bucket fills up. And then you spill over and you got migraine. So we have to, he says, and I'm just quoting him, we want to empty the bucket. We need to learn how to reduce stress. Now that's the brain issue. If we train the brain, make it more neuroplastic in a healthy direction, it has a greater capacity for stress. So the bucket can get bigger. We can handle more without getting a headache. If the hormones get regulated properly, that's going to help not have that big swing and it's mostly ladies, but it happens to men. So we want to regulate those hormones. And so now we're talking nutrition, metabolism, and then weather. We can't do too much about that. We're working on that in the whole world, aren't we? But yeah. I want to show you something. So we use a therapy, one piece of the therapy. So we use eye tracking therapies for migraines and many different things. But this is a little bulb you can see here, an air, and this actually fits in the ear. And this is called insufflation. This is really pretty neat stuff. Insufflation, or ear insufflation, is pumping air into the external canal, which causes stimulation to the tympanic membrane. As you can imagine, you feel a little bit of pressure, and that there's nerve endings in that go right into the brainstem. So this has been called a migraine stopper, Pretty remarkable. So actually, there's migraine stopper right there. This is available online. It's one of my colleagues, a functional neurologist in Australia, and he developed this. We were using this, this is a home model for a patient. So as soon as the migraine is starting, they're going to put this in their ear, hold this, and they're going to pump air for a certain amount of time, and then the migraine can be reduced right there, right in the middle of its onset, which is remarkable.
Wow.
And this is one of the most interesting things for patients. We've used it in the office. Now patients can actually get it and cut the migraine off midway. And you say, well, that's just temporary. It's much better than taking medication. Most of them would agree. And it actually is stimulating the brainstem, which may develop some plasticity while they're under treatment here for the longer term strengthening.
Wow, great stuff. I got a couple of minutes. So,
yes.
and I'm not going to be able to do justice with this. Concussion.
Well, there's a lot of things on the wall behind me over there, but you probably can't see them in a dim light. So Concussion is a big issue. It's become more common because of the movies and the NFL. We now know, I would say I know in my practice that a lot of people, the majority of patients say, I've never had a concussion. If you ask me, have you ever had a concussion? I would say, I've never had a diagnosed concussion, but I actually think I've had around 10. I've counted through car accidents, rollovers. You know, I was slightly stunned, football, soccer, pole vaulting. I mean, I've done all kinds of fun things, and I've whacked my head. So I think I've had enough subconcussive blows, perhaps 5 to 10 concussions, never diagnosed. And your brain adapts. It's very adaptable. It's plastic. So it can adapt on top of problems, and this can lead to other things. So you say, no, I'm fine. I'm doing really well, even though I hit my head 15 years ago. But when we start to measure things like the brain map, like the balance testing, like the eye tracking, then we start to see maybe they're not so good. Even though they're high functioning, many people, multiple impacts can play a role in changing the brain. And like Dr. Daniel Amen says, listen, we're going to come to a point where we need to have brain evaluations as a yearly checkup, just like we did physicals, because it is the most crucial hub that drives all the other functions. So a lot of people have concussions or subconcussive blows that affect their brain. They may not really think they're having any effects. It could take years for it to show up because everything gets compensated. And so I find that people get decompensated around my age. Around those 40s to 50s, they start to have a little bit of those problems. They may not relate it to earlier impacts, and it may not have been a serious head impact that put them in the hospital, but I fell in my kitchen. You know, hey, I'm going to warn your listeners, mopping is dangerous. I fell in my kitchen some years ago mopping, and I couldn't put my hand down fast enough, and I hit my face on the floor tile.
Wow.
Was that a concussion? I can tell you, I hadn't been hit that hard playing 12 years of football. So I was surprised, you know, so I think it's definitely an issue. People should, the evaluations help us understand they may have had changes because of a head impact, and we can maybe improve those things.
Outstanding. So great stuff. Everybody's going to want to know more. How can they get in touch with you? Give me your social media handles.
All right. So you go to Instagram, Bagnell Brain Center. It's all Bagnell Brain Center. Instagram, Bagnell Brain Center at Facebook. And then also on our YouTube channel, Bagnell Brain Center, we have videos that patients have allowed us to share their stories in very well-produced ways. And we have new ones coming up in the next 2 months that are really interesting in the new brain center here that we opened, as you mentioned, in Pinecrest. So Instagram, Facebook, and of course our website, bagnellbraincenter.com, Bagnell Brain Center. There you
Outstanding. Guy, it's been great. We've got to do this again. We'll book you up. So everybody, Dr. Mike Bagnell, Dr. Rob Silverman, Proven Health Alternatives, always yours in health.